Welcome to the Bioethics Babe podcast, where we examine the tough questions in human flourishing in light of science, faith, and culture. I'm your host, Arina Grosso-Agnew. Now let's dive in. What does it actually feel like to lose a child by miscarriage? What happens when the positive pregnancy test line starts fading again, and you realize you're about to go through another miscarriage? Miscarriage is far more common than most people realize. Studies estimate that roughly 1 in 4 pregnancies ends in miscarriage. Yet many women say they felt completely unprepared for what miscarriage is physically, emotionally, and spiritually. Why are so many couples silently carrying the grief of infertility and pregnancy loss, even inside churches and faith communities? And why do so many women feel isolated, dismissed, or unprepared when miscarriage actually happens? Today's guest has lived through 7 miscarriages, while also raising 2 living children. She has experienced the heartbreak of repeated loss, the fears one experiences in a pregnancy after miscarriage, and the tension between longing for another child and wondering whether she can endure another loss. She's also spent years advocating publicly for miscarriage awareness, restorative reproductive medicine, and the dignity of preborn human life, including children lost through miscarriage. Gabriela Anastasopoúlou is a civil rights attorney in the Washington, D.C. area, with expertise in medical provider rights of conscience, religious liberty, and other civil rights. Her extensive personal experience with miscarriage and longtime dedication to the rights of preborn children has made her an outspoken advocate for miscarriage awareness and education. In this conversation, we discuss what miscarriage is actually like behind closed doors, how repeated loss changes a woman and a couple emotionally and spiritually, why she and her husband chose restorative reproductive medicine instead of IVF, and what our culture still struggles to understand about grief, infertility, and the humanity of preborn children. Gabriela, welcome to Bioethics, babe.
Thank you, Rena. Thanks for having me. I'm excited to be here.
It's such an honor to have you on, and especially to talk about such a difficult topic, but I think one that obviously it doesn't get enough attention. There's a lot of women and couples going through silent grief and pain. And so we just want to shed light on this topic and hopefully help other couples as well.
Absolutely.
So, Gabriela, what did motherhood and family life look like in your imagination growing up? And what example did you have in your own family?
Well, I come from a big family, as you know. I'm one of 10 children, and I'm the oldest girl in the family of 10 children. There are 6 after me. So a lot of helping take care of younger siblings, which I loved doing, changing diapers and doing bottles and all that stuff. Of course, it's a little easier when you don't have to wake up in the middle of the night to be the one doing it also, and you're just helping mommy do it all. But it was just a very normal expectation that you grow up, you get married, and unless you go into religious life, and then you just start having kids. And the kids just come. And that's my mom's experience. She had 10 kids in 15 years. So it was really back to back. She was having children. And then we went to a very traditional Catholic church growing up in the Latin Mass rite. And so there's just a lot of big families who were there. It was very normal to see 7, 8, 9, 10, 11, 12 children in a family. So that was just my understanding of how it was going to be. I always wanted to have kids. So the idea was lovely to me about, and of course at like teenager, preteen, you're like, oh yeah, I'm going to be 21 and then I'll get married and start having kids. And then when you're 21, you're like, actually, I kind of feel still young. Some of my siblings did get married at 21. I didn't until I was 27. But I think that's generally what my expectation was. You just get married and start having kids.
And I think that especially in faith communities where people do have big families, and I love big families, there's this expectation that everyone is going to have a big family, but
Yeah.
there's underneath all of that, you don't know what someone's going through. They might want a big family and they might not be able to have a big family, or there's a reason why they're spacing. And especially in the Catholic Church, we talk about that for very serious reasons, you can space using natural means, etc. And we've had an episode on this as well. But, when you and your husband first got married and started trying to have children, what did you expect that journey to look like for you?
Well, when we first were married, we were actually living in 2 different states. So and it was gonna be, like, about a 6-month arrangement while he finished his postdoctoral fellowship. And so there wasn't like a, "Oh my goodness, we need to have a baby right away," urgency. It was just sort of like, just let it happen when it happens kind of thing. But then the pandemic happened. We got married at the end in the fall of 2019. In 2020, then I just, with telework, ended up moving to where he was, and we got pregnant pretty shortly after that. So it was, again, I think just a continuation of that expectation that we would just get married and start having kids. I didn't feel a need to be rushed about it because I had, I think, that false sense that a lot of women have that you just get married and it happens. And so even if you put it off for 6 months or a year or something, because, or in some people's cases longer than that, in today's society, people will do that a lot for career reasons and other stuff. You just don't think there's going to be an issue, especially when you're still in your 20s.
And I mean, you didn't even think that there was going to be an issue because, like you said, you got pregnant right away with your first child, and so you probably had no clue that you would face difficulties after that, right?
Well,
Was anyone?
my first pregnancy was actually my first miscarriage. Yeah, so, that I think was part of the surprise of it all, was I was expecting the first well, I was just expecting first pregnancy to be normal, and it wasn't, and that's when I sort of started learning a lot about the statistics about miscarriage and everything that comes along with it, and just the whole unknown of the experience, and I think the craziest part about it, because you're sort of asking about my expectation going into it, I had no idea that anyone in my family had ever had a miscarriage until I had a miscarriage. And then my grandfather on one side, because my grandmother was already passed, and my grandmother on the other, both called me to say that both grandmothers had had miscarriages. But it kind of goes to what we're talking about, that silent grief. They just never talked about it. I had no idea.
Yeah, and I think that this is part, as you're saying, part of the issue is that it's kind of a hidden grief, right?
Yeah,
People usually don't end up sharing about miscarriage until it happens, like it did in your family and
right.
with friends. And personally, we had two miscarriages, and it's hard to talk about it, but I think it's important to talk about it
Yeah,
as well.
absolutely.
So you've now experienced seven miscarriages and also have two living children. That is an extraordinary amount of grief and joy intertwined together. How do you even begin to describe that experience to someone who has never walked through it?
Well, it is a lot. It's a lot of just chugging along. It's a lot of on the fly figuring out things, what's going on, learning everything. And I think that's part of like what you're talking about, this having these conversations for other people to be able to listen and learn from, hopefully saves some people from having to go through just the wading through the trenches that I had to go through. Like I said, the pattern of my miscarriages was I had one before my first child was born. And there's a statistic that says with first time pregnancies, it's a higher chance of miscarriage. And then for whatever reason, with later pregnancies, the risk drops off slightly. So I really just chalked it up to, okay, I was that unlucky person, the one in four whose first time pregnancy ended in a miscarriage. And so I wasn't thinking of it as a potential issue, underlying issue, especially too because that happened in April of 2020, and then I was pregnant again with my son in August of the same year. So it was a pretty quick turnaround to then be pregnant again, and then everything was going not fine and normally with that pregnancy, absolutely no indicators of any problem, no issue, completely normal delivery. Everything was just as normal as you could possibly ever want for a pregnancy and delivery. And so when the miscarriages started coming pretty back to back after my son was born. Let me think. I think he was just over a year old when I first got pregnant again. That's when it was really starting to hit me like something is wrong here. It doesn't make sense. I'm getting pregnant every time we try, and every time it's not working. And so it was 6 losses from my son to my daughter, who was just born 15 months ago. And there was just a lot of unknown, but your mindset just changes because it's over a good amount of time. There was a good amount of time over which those 6 miscarriages happened. And it starts off with the like blindsided, you feel like you're getting hit by the ton of bricks. Like, what is going on here? And then you're trying to get answers. You're trying to do the medical reviews, do all the analysis, whatever. And then it sort of settles into maybe this is my new normal. Maybe this is just the way things are going to be. And it's sort of stealing up your mindset to just be like, it might just keep going this way until I hit menopause, or maybe I'll get lucky and another child comes along that survives. And I think for me personally, I just wanted so much to be a mother and to have a big family. And that was always my dream. So that really girded me for pushing. Okay, this is going to be my new normal. Then I'm just going to deal with it and keep going because I know what I want. And I'm going to just have to trust God's will on this one. Yeah.
Mhm.
Yeah.
And they actually do say that after miscarriage, your chance of pregnancy increases in the first 3 months after. So I think it's
Oh, I didn't know that one.
up
That's
to
really interesting.
70% chance higher, right? I
Fascinating.
want to fact check that, but it is a higher chance that in the first 3 months after miscarriage, there's a higher chance of getting pregnant. So that happened, right, in
That's
your
really
case.
interesting. I mean, I had been told that by multiple providers that for people who have repeated unexplained miscarriages, which was my situation, but if you have at least one live birth, then your chances of having another are very high.
Mm.
So that was kind of the only statistic I was holding on to. Yeah.
That's a good statistic to hold on to, and it's very
Yes. Yes.
encouraging. And essentially, they say that if you're able to, so obviously, in order to get a positive pregnancy test, that means that the baby implanted, and
Yeah.
so fertilization happened, and the baby implanted.
I'm
They say
clearly
that,
ovulating.
right. So at least
Yeah.
those things are encouraging. And then it's just figuring out why did the miscarriage happen. A lot of the times, miscarriage happens because of chromosomal
Yeah.
abnormalities, but it could be something as, for example, low progesterone, et cetera, et cetera. So it is this journey of finding out what is it about our situation. Is it the sperm? Is it the egg? Is it the hormonal levels that's causing the miscarriage, or is it just a chromosomal issue? Um,
Right.
then you go down this whole journey of trying to figure out what it was. So take us back to that first miscarriage. What do you remember most vividly about those first moments when you realized something was wrong?
I knew something was wrong because I started bleeding. And I had known of women who'd had miscarriages. Of course, I'd seen it dramatized on TV before. Dramatized is the word because they do make it in some ways more dramatic. Everything about childbirth and everything is a little more dramatic on TV. I mean, it can be dramatic in real life too, but I just knew something was not right. And I knew that sometimes women can bleed and then it goes away and it's fine. There's implantation bleeding that can occur. There's a few other reasons that can happen. That happened to a sister-in-law, one of my sister-in-laws. She started bleeding and they went to the hospital. So she was bleeding a decent amount. But then it stopped and her pregnancy continued and the baby was fine and, is now like 2 years old and super adorable. But I just knew something was wrong, and I remember my husband, my poor husband, trying to encourage me like, "Oh, maybe it's nothing, maybe it's nothing." And I called the OB-GYN to try to get an appointment, and we were waiting to figure out, I think, if we were gonna get the appointment or not, because a lot of OBs have a policy that they won't see you until at least 8-week pregnancy, and I think I was at, like, 7, just, close to 8 weeks, but it was 7 weeks something. And, I remember my husband sitting on the phone with his dad, and I was sitting there just, like, thinking about what was happening and just feeling like something's not right. I just know it. And I just started crying, honestly. And my husband's like, "What's going on?" And I just told him, "I don't wanna have a miscarriage. I don't wanna have a miscarriage." But, that's what was happening.
Mhm. Yes, and they say that actually miscarriage is much more when it happens, it is much more likely in the first trimester.
Yeah,
Once you get past the first
first 12 weeks.
trimester, the percent drop drastically. I think like
Yeah.
90 some percent is in the
Yeah,
first
it's shocking
trimester.
how
Yeah,
much it is.
yeah. So it's almost like I think that people who have not experienced miscarriage just think as you know, you and I thought, oh well, pregnancies just go as they should and everything is okay. But in reality, at least for me, with our son, getting past that first trimester, there's a big sigh of relief.
A lot of people won't say anything about their pregnancy for that reason. I didn't understand that until starting to go through this myself. I was like, why are they waiting until they're so far along to say anything? Aren't you excited? Don't you want people to know? I mean, ultimately, I just decided to still tell people as soon as I knew. With every pregnancy, as soon as I knew, I was telling people. And I think for me, it was just a way to affirm the humanity of those little children. That even if I was going to have to go through a certain amount of grief and a certain amount of awkwardness for other people to like, how do they respond to the grief that I'm going through? It just was like, their life was here and I want people to know that.
Yes, and that's a beautiful way of going about it too. I mean, obviously for every couple, they have to make their own decisions about that.
Absolutely. And what
But
they're
but there
comfortable with.
yeah. And but it's beautiful to celebrate the life of that child, even if that child only lives a couple weeks or a trimester or, is born and continues to live. So I think that that is a beautiful way to, especially for people who are pro-life, it puts you out, on a limb a little bit, but at the same
Yeah.
time, you're also saying, we have a baby in there, and we're celebrating that baby. That baby exists already, and you're already a mom, right?
Uh-huh.
You're a mom, to 9 children,
Yeah, that's true.
you know? And I
My
think
mom
that
told me I'm giving her a run for her money. And she said, well, you've already got me beat because you've already got 7 in heaven and I'm still waiting. So,
Uh,
there's ways to remember the good side of all these things.
yes, yes. Well, let's talk a little bit about something. It's hard to talk about this, but a miscarriage is often discussed in abstract or clinical terms, but not in practical human terms. For a woman experiencing a miscarriage for the first time, what should she realistically expect physically and emotionally? And what is the hardest part about actually going through a miscarriage at home?
Well, I'll start with the hardest part last. I think the hardest part is not knowing what to expect. So, if you're listening to this podcast, you're already in a better place because hopefully we will help you know what to expect. And that will just help assuage a lot of fears and give you a sense of, I know what to do here. I know how to handle this situation. I mean, you're never going to be able to perfectly know what to expect. Every miscarriage, like every birth, is a little bit different. But that for me was the hardest part, was not knowing. But it really varies depending on when the miscarriage occurs, of course, how far along you are. You can have a very, very early miscarriage, which you've sort of described in some of the intro, where it's called, the technical term is a chemical abortion, which I think is so severe and awful sounding. But it's just when that line appears that shows that you're pregnant, and it can be super, super faint. I know the pregnancy tests say, like, don't read it after a certain amount of time or whatever, because when your pregnancy test dries out, it'll make a color line where the line is supposed to be for a positive pregnancy test. That's sort of a dull color, and people can misinterpret that as a positive pregnancy. But sometimes the line will show up a little outside of the reading window, and it is actually the color line for positive pregnancy. So I had that happen a few times with some very early miscarriages. And in that case, it's often, for me, it was very much like going through a period for those very early miscarriages. So that wasn't my first miscarriage, but I had 2 or 3 very early chemical miscarriages, and that it was, for me, it wasn't that different. But the further along you are, of course, the more that you have placental development, the embryonic development, all other tissue development, all your hormones and everything are rising to address supporting the pregnancy. And so it's going to be a bit of an image of going through labor. when you have the miscarriage. And for some women, you start with the bleeding like I had, and that was the indicator that something was wrong. Sometimes you go into the doctor's office and there's no heartbeat on the scan, the baby's not growing. And so then it's a matter of whether or not your body's going to have the miscarriage occur naturally on its own, or if you're going to need some assistance to address the situation. So I've been lucky in that I've never had to take any medication or have surgery. A D&C is the surgery that's usually done to address a miscarriage where your body is not passing the baby and all the tissue and everything the way it's supposed to. You can also take medication to induce the miscarriage as well. And I know people who've done that. And that, it's its own journey in and of itself, having to deal with the medical interaction. So there's a plus side, I think, of doing these things at home. You don't have to do the interaction with providers, especially if you don't have a very pro-life or very sympathetic provider who's going to be sensitive to things like if you want to have a funeral and you want to be able to save the remains for the funeral, there can be a process you have to go through if you have the miscarriage in the hospital or have surgery in order to reclaim the remains so that you can do a burial. But like I said, it's like going through labor. And so that was part of the shocking part of my first miscarriage. Like I said, I was almost 8 weeks along, and the baby appears to have passed when they were about 5.5 weeks or so. So I did go in for a scan. I convinced them to come to let me in to be seen, despite the very strict. And I know people who the OBs were like, no, I'm not seeing you. Sorry. Like, just if you're hemorrhaging, go to the ER. Otherwise, stay home. Was a bit dramatic on the phone. So that they would be convinced, like, okay, this person really needs to be seen. And I went in, and the nurse who saw me was very kind, and she did the scan and everything and told me about the growth being restricted. And she wanted, I think, you could see in her face she wasn't feeling good about it, but I think she wanted to be encouraging and was like, well, sometimes the bleeding happens and it goes away, so wait and see. But when I went back home, I think within about a day, the bleeding really continued and increased. It wasn't like hemorrhaging level or anything. And so because everyone kept talking about hemorrhaging level, I kept thinking like, oh, until it's hemorrhaging level, it's not a problem. But that's not the reality. The reality is you can have more like period level or a little bit higher than that bleeding, and that's the miscarriage. And then at a certain point, I had what was labor pains effectively. It is painful, and for some women, it can be extremely painful. It was very painful for me for probably about 2 hours that I was laboring through the miscarriage. And, like I said, this is at almost 8 weeks pregnancy, so it's still pretty early. So it can be even more intense than that if you're further along. I know some women who've had miscarriages at home who just described it as the worst pain they've ever felt. And if you've never been through labor and delivery of a full-term child, it is shocking because you haven't done all your birth classes and your routines to prepare for that kind of pain. So that can be intense. And then you're going to end up passing whatever tissue is in your uterus. And that could include, there's a website that the name is escaping me right now. And I'll have to send it to you so you can share it on the link. But they provide miscarriage materials. So a strainer so that when you're on the toilet or in the shower or wherever you are and the miscarriage is happening, you can catch all the tissues or the baby, if the baby's there and identifiable, depending on how far along you are, so that you can salvage that for remains. In the Catholic Church, whatever remains you can collect, regardless of if the embryo is developed enough for you to be able to be like, identify them, that's all acceptable to take for your funeral, for your burial. So if you want to do that and have a service, I really encourage people to do it. And I think for me personally, being able to do those services helped a lot with the grieving process. And it was a way to honor my children. So you can get a miscarriage kit that has all of those materials, and they like overnight it to you if you need to. And it comes with a jar and everything so that you can preserve all the tissue. I know it's horrible and technical to sort of talk about. And I remember the woman I spoke to with a mother's piece here in Virginia, a mom's piece. And I remember her telling me that, like, I'm so sorry. This is so technical and horrible to be talking about as you're going through this. But it was life-saving to me that she just was willing to have that conversation with me, and that's where I'm sharing it here. But, you get a container, and you're just gonna put everything you can in the container, and you might put it in your freezer, depending on how far out from a funeral or other services you have planned or are able to plan. And the miscarriage can take place over an amount of time. For my first miscarriage, it happened within about 2 days. Everything had passed, and the bleeding really decreased within a few days after that. And then I had a later miscarriage where I had been on progesterone because, given my history, they had started giving me progesterone as soon as I found out I was pregnant. And so that one was a bit strange because once we found out there was growth restriction, the baby wasn't growing, there was no heartbeat, I stopped the progesterone to see if my body would, have the miscarriage on its own naturally. So there was like a week delay where nothing was happening. I still looked pregnant and felt pregnant, but I knew my baby had passed and I was just waiting. And that was probably one of the more intense. It wasn't as painful as the first one. There's something about your first pregnancy, whether it's a miscarriage or full-term labor, that after you go through it, usually it's a little easier the next time. But I was further along and there's a lot more placental tissue development. And that actually took a whole week for everything to completely pass before the miscarriage was over. So there can be a wide variety. I think that a lot of the online stuff tends to only talk about hemorrhaging problems or what to expect at like a 12-week miscarriage, which is a lot more intense, a lot more blood loss, a lot more painful. And so that in between, which is where all of my miscarriages occurred, is not really covered. So there's a variety in there. And I think that kind of hopefully is helpful to understand it's not necessarily going to be this end or that end, the experience.
Yeah, no, thank you for sharing all of that. I know it's raw, and I think it's important to share these details because it's hard to find them, right? You have to really search for this information. And one of the things that surprised me was that miscarriage, as you said, happens over a period of time. It's not just, it could
Yeah.
be in one moment, or it could just take a few days, etc.
Yeah.
And so what we don't know is that women could be walking around actively in the process of a miscarriage and not even know that, right?
Yeah.
And they're holding on to that inside themselves. And so there's a lot there that we don't even know what people are going through. Uh,
I
and
have to
it's
tell you a crazy story actually on that part. I knew I was going through a miscarriage, one of my miscarriages that were further along. So I'd been through several before. I knew what to expect. This one was a little bit weird in that I had taken pregnancy tests and they were coming back negative. So I was like, okay, I guess I'm not pregnant. But then my period was delayed a week. And that's extremely unusual for me. In my case, I was like, what is going on here? So I finally took another pregnancy test and it came back positive. And I knew if I'm not getting a positive pregnancy test until a week after my missed period, this is not a good sign. And it was a very faint test also. And so I remember like realizing this is what was happening. Like the bleeding hadn't started, nothing had started. And calling my supervisor because I was traveling, but I was working remote. And he and I, fortunately, he knew I had been through this before. He's a very kind, faithful man. And so I could tell him, look, I'm going to have another miscarriage. I'm going to need to take off. But we had a meeting with the director of our office in like an hour about something that I was presenting on. And, nobody else could take over that meeting for me. And I was like, I'm going to do the meeting because I don't want to have a conversation with the director about what's going on or try to explain that or make a big deal about it in a medical emergency. I feel like doing it is going to help me focus on something other than what's happening right now so that I can just sort of emotionally handle it better. But yeah, I went and did a whole work meeting with the director of my office for an hour as I knew I was about to run off after that to the OB to see what could be done, if anything. So you're very, very right that you just never know what situation someone could be in at any given moment.
and you're describing how miscarriage can be like labor, right? Because obviously when a miscarriage happens, your body is trying to expel that child, and so you'll have contractions, right?
Yeah.
And somewhat for some people, depending on how far along you are, they're stronger. or weaker. But even so, it's still there's a mimicking of what happens during labor of a
Yeah.
live child. So, with all this experience of your different miscarriages, you mentioned that the first one was, very difficult, and obviously the ones that where it was farther along. Were there other points in any of the miscarriages where that changed you most deeply? What was maybe an experience or a memory of something that really affected you when you were experiencing the miscarriages?
Well, one thing each one was quite different. Like I said, because each one brought a new realization about what stage in my journey of trying to figure out what was going on I was at. It was the first miscarriage was just that could this even be happening to me? And then after my son, when I had was born and everything was fine with him, the next miscarriage was again just this like shock, like okay, something's probably wrong. And then the next miscarriage after that was like, okay, something is really not right here. And I'm trying and trying and trying to figure out what's going on. And I think at a certain point, I hit kind of a blur where it's hard for me to remember all of the details because you're just like going through it and just trying to just keep on with your life. But something about that time that does stand out to me is my son because he doesn't understand what's going on. He doesn't understand why mommy's upset. And so there was this, I remember with one of my miscarriages, and I think it's the one I just described, I was further along. I'd been taking the progesterone. And so the whole thing was a more intense physical experience. I remember he woke up in the morning and was crying and wanted to be picked up. And I realized when I stood up after being in bed all night that, oh, the miscarriage is happening. I yelled at my husband, like, go get, you know, our son, he's crying, he needs to be picked up. And then I ran to the bathroom because everything was happening. And there's this sort of odd reality of life keeps going. My son is there and he needs me to be his mom. He needs me to keep going. And to have somebody or something to push you to keep going is just hugely significant. It makes you realize like you can push through this. You need to push through this. And so I think just there was this sort of odd life and death comparison, which always happens, around. We see it in movies a lot, like a funeral and a birth at the same time. But I think, all speaks to just that reality of our finite nature of life as it is. These things just coexist. And it can feel really strange, but it's also just part of being human. And so in that sense, it was just a really grounding, almost sounds like a euphemistic term for it. I don't know. But it was just a realization of just how human this is in our broken world, not a perfect world, a broken world.
Hmm.
Yeah.
Yeah, and with all of this, obviously, it took a lot of investigating. What did came out of it in terms of what did your labs show? And you were obviously able to have another baby born. Like you said, she's doing great. But getting to that point, miscarriage after miscarriage after miscarriage, how were you finally able to conceive and carry to full term again?
I have no idea. Through the grace of God, I would say. Because the infuriating thing about my situation is we just kept getting no answer. I saw two maternal fetal medicine specialists. They did every test under the sun: 3D ultrasound, genetic testing, testing for various inflammatory conditions, blood clotting disorders. We looked into the whole battery of tests that they look into when someone has repeat miscarriages, and it just nothing was showing, nothing was showing, nothing was showing. The only thing that came up was, and this was a few months before my daughter was born, so we think it could be part of the equation, but it's just hard to really say definitively that's what it is. But I remember my physician my OB, who's NAPRO certified, so natural family planning, the whole natural reproductive technology approach. And she said, well, You can do a test, a blood test, where you go in every other day during certain parts of your cycle, and we look at the path of your hormones to see if something's off there. But she said, usually people have a little bit of what's called a luteal phase defect, where the production of your hormones around the luteal phase, ovulation and post ovulation, are not where they should be. But she's like, typically, it's not a huge thing, and we would just prescribe progesterone, and you're already on progesterone, so our treatment plan wouldn't be any different. So if you want to do the blood test, you can. But she was just kind of like, and of course at that point I'm like, yes, any test under the sun, let's do it, because nothing has given me an answer. So we did the test. And I remember her coming into the doctor's office and looking at me for our consult after the results came back, and she said, "You definitely have a luteal phase defect. And it's the worst one I've ever seen." So she was like, okay, we're not going to treat it with just progesterone. And so, that example to me is a good one of how, I mean, doctors are human. They're working off of statistics, likelihood. They have to take into account what's going to be stressful for the patient to do more testing, what is sort of a futile care that's just a, waste of resources and time and doesn't really help anything. They have to think about all these things. And so you do have to really get into a mindset of what do you want and what are you willing to go through and push for that. And so, I just had already decided I'm going to do every test. Like, I'm going to do every test. I had multiple doctors tell me, like, maybe you should stop taking pregnancy tests. Maybe you should take a break. Maybe. And I was like, no, I know myself. I know what I want. I'm very goal oriented. And so I'm like, this is what I'm doing. And so we did the test. Like I said, I got the luteal phase defect. And so what she ended up doing as my treatment plan was putting me on a drug called tamoxifen. It's described as a sister drug to Clomid, which if anyone's familiar with like the IVF process, Clomid's a drug that's used often in that process, typically for women who don't ovulate at all or very intermittent ovulation. So tamoxifen's a less potent version of Clomid. And so because of that, it also comes with less risk of twins and triplets. So on Clomid, you have a higher chance of conceiving twins or triplets. So what it basically did, it's interestingly an estrogen positive cancer drug also, but you take it in a short spurt during an early part of your cycle, and it suppresses your estrogen, or not suppresses your estrogen, but it makes your brain think there's no estrogen being produced. So then your body starts producing extra estrogen. So then your estrogen shoots up really high so that when it drops, in order to trigger your ovulation, you're starting from a higher baseline of estrogen. And then when your hormones start to pick up again post ovulation in order to support your pregnancy, progesterone and estrogen, you're starting from a better baseline, and your overall natural production of your hormone is going to be much better, which is significant because when they give you progesterone as a supplement, it's a synthetic version, and they've never been able to truly mimic your natural progesterone. So it just doesn't work quite as well as natural progesterone. So to the extent that they can get your body to naturally produce more, it's better. So that definitely had an impact. Taking the drug, I felt the difference. It made a difference that, the numbers were coming back better. I still had one miscarriage after starting that treatment. And that's part of why we're like, okay, maybe that particular miscarriage was a chromosomal abnormality or something like that. Or maybe the luteal phase defect is only part of the problem. There's a lot of unknowns. But the next time I conceived after that, while doing that regimen, I conceived my daughter. So I think it helped, but
Yes, and you're right. So there are three main drugs that are used to help with ovulation. You mentioned tamoxifen. There's also letrozole, and you mentioned Clomid,
uh,
and they all work differently. And like you said, Clomid, there's a higher chance of multiples, etc. But it's working with a, a healthcare professional who actually knows what to test for in terms of the labs, but also then and what you need, if you have endometriosis, you might need something else. You need surgery. If you have a luteal phase defect, or you need boosting for your ovulation, or PCOS, there's various reasons why women might not be able to conceive, or conceive and have miscarriages. And it could also be it's the husband,
yeah,
you know
that too.
a lot of focus is only on the women, but
Yeah.
but
There's a
fertilization
longer
is
list of things that could be wrong on the female side, but there's still a very high prevalence of things being wrong on the men's side too.
right, right.
Yeah.
So I think that's like 30% chance it's the woman or 30% chance it's the man or a combination thereof.
Yeah.
And so there's a lot of tests to do and that takes time and effort, but especially if you're not wanting to go down the route of IVF, and we've had episodes on IVF, why someone may not want to go down the road of IVF. One, well, chiefly because embryos are killed in the process, die in the process, and also it's outside of the unitive and procreative act of husband and wife. So obviously, even though trying to get to the root cause of the problem might take longer, actually they do the same with IVF. Right before that, they make you go through all these tests, etc. So,
Yeah.
but trying to find out what is the reason why this is happening is actually getting to what's the cause, what's the disease, what's happening there, and talk about restoring reproductive health. Right, that is actually restoring reproductive health as opposed to circumventing it. Right,
Yeah.
IVF is a way to circumvent it and say, well, we're just going to create a baby in a lab and then implant that baby after looking at eugenically which embryo to choose from. But with the restorative reproductive approach, you're actually trying to restore health. So,
Yeah.
what are the reasons that you and your husband chose to go the route of restorative reproductive medicine as opposed to IVF?
Well, I think you touched on some of them. I mean, I'm a practicing Catholic, so that's a component of it. But even absent my particular religious views, my strong pro-life views about the dignity of life from conception plays a huge role in it. And it is, there's so many varieties in the ways you can approach IVF these days. Doctors will let you implant every embryo that's created in order to avoid, destruction of embryos. And there's some different ways that people try to address some of these things. But I think the heart of it is like what you said, that at the end of the day, your baby is coming to existence not through the husband and spouse's personal activities in their expression of love for each other, but in a clinic with a doctor who's never going to have a relationship with that child, who's got a very strong financial interest in the creation of this child. And it's just it's not an environment that's evocative or that in any way expresses the dignity of that embryonic life. And especially as someone who was just so torn and mourning over the death of embryos at a very similar stage of their life, it seemed very hypocritical to then be, because I remember we were recommended to go, not for IVF, but to go see a fertility specialist about doing intrauterine insemination. And it's where they give you an ovulation boosting drug like Clomid, and then they artificially inseminate you with your husband's sperm. I remember going to the appointment because I was like, okay, look, I'm just going to go meet with this fertility doctor because I want to understand more. I very much knew I wasn't going to do IVF. And I thought this artificial insemination sounded weird because, to your point about restorative reproductive medicine wanting to understand what's wrong, the maternal fetal medicine I was meeting, for maternal fetal medicine specialist I was meeting with, was telling me to go do this as if it would be helpful, but we still didn't know why I was having miscarriages. And he sort of described it as, well, it'll help you get pregnant faster and more predictably. And I'm like, okay, but if we don't know why I'm having miscarriages, doesn't that mean I'm just going to keep having miscarriages? So I'm just going to have miscarriages more frequently and predictably? Like, it was just a very strange, like, not an actual answer to what was happening with me. But like I said, I still went to the appointment because I wanted to figure out what was going on. And I remember asking the doctor, like, okay, I understand why giving me Clomid or a similar drug would be potentially helpful because producing more eggs and improving the hormones, everything like that. But what's the deal with the artificial insemination? Like, is there some sort of clinical benefit? And he said, well, to be honest, there isn't. It doesn't like in some very rare cases where the man has some like certain issues, it can be helpful to identify like higher quality sperm. But and I'm just like, why are we medicalizing something that doesn't need to be medicalized? I was just floored by that. And he, I'm glad he was honest about it and was like, yeah, okay, there's no medical benefit. So if you want, you could just take the drug and skip the artificial insemination part. But it just blew my mind. And I do
Wow.
want to say, a lot of times people describe what we were talking about with IVF about how the parents are removed from the actual moment and process of the child being created. And so sometimes people describe it as like, well, they're not created in love, or it's like in an environment that's, not evocative of their dignity, like we said. And I do want to just say, like, I know couples who've gone through IVF, and they are full of an enormous amount of love and desire for their children. And they go through, frankly, hell to try to get there. And so I don't want people to ever think that we're saying that the parents are lacking in love or somehow that love is not transmutable to their child. Because I do, having gone through what I've been through, having a huge amount of empathy for people in those situations. And I've seen women, like I said, just go through a lot to try to get that baby. And they really just have these huge maternal hearts. But the core of it is just like we were saying, it's not treating a human person like I believe they are a human person, even at the embryonic stage. And it is not treating that human person with the appropriate dignity that they are owed to build them in a lab as part of a financial transaction and done by a doctor who's never going to have any relationship with that child or who doesn't have really an interest in them as a human being. And that's the crux of the matter.
I think that's really beautifully said. Of course, even even for children who are conceived through IVF, they have full dignity. They have the same amount of dignity as any of us in conceived in any way. We're talking about, and as you said, even if the intentions and of the parents are there, obviously they want a child so badly, and there's and it's coming from a place of love. When we look at the do the ends justify the means, right?
Yeah.
And going back to some of
Yep.
those bioethical principles that just because we want something so badly doesn't mean that any means to it is the right means. And so we can look at the desire of parents, and say, yeah, you have a beautiful and good desire, but let's go about it in a way that is dignifying of the child, right? And what
Yeah.
does the child deserve? The child deserves to be conceived in the loving act of husband and wife. That is what the child deserves, and really that the marriage deserves too. That the husband and wife are the ones who are becoming parents through each other, and not bringing in a third party. One of the things I learned in another episode is that the embryos actually, because of the lab conditions, the temperature, whether it's too hot or too cold, whatever, might also be affected by those things taking place. And so we have no idea what kinds of even physical and health conditions may result from tinkering with life this way. And so think I think it's a beautiful point, and at the same time we can say, you know what, it's really hard. It's really hard if you're going through infertility or miscarriage and you're wanting children so badly. I understand, personally, and we had Lee Snead on and talking about her story
Yeah,
with
that's a great
infertility.
episode.
But I think that it's really good to talk about that because it's not saying those people are bad or evil. It's just that let's look at the methods that are used
Right.
and to think of what is the most dignifying for all parties involved, for the
Right.
babies, for the parents, etc. I want to ask you about just more of the emotional component of this. So what was it like emotionally seeing that pregnancy line at positive test and then repeated losses, or for example with your born children, seeing that line and then realizing, wow, okay, this baby is doing fine, and we're just going to take it day by day.
Well, like I kind of alluded to earlier, I got very used to seeing two kinds of pregnancy tests. One was like for my son, the nice bright blue. It came within the 2-minute window, like you are pregnant. And that suggested to me this is going well. That baby's been developing right on schedule. And so all the hormones are being produced properly. And that's why the test was coming back so clean and bright. And for most of my miscarriages, especially the later ones that I was having, they tended to be earlier and earlier for whatever reason as I continued having miscarriages. And so I got used to seeing that super faded line telling the difference between what's a dry mark on the pregnancy test versus a super faded line. And I mean, the first times, like I said, were the hardest emotionally because the line was a brighter line. It seemed like things were fine. And then it was realizing things are not fine. At a certain point, like I said, I was very goal oriented, but also sort of appreciating this is my new reality. I think that helped me to just accept this is my new reality. And so then if a baby comes, you're like overjoyed because it's more than you expected, as opposed to like just completely crashing, letting yourself down every time you take that test and it's not positive at all, or you get that faded line. So I had developed an expectation of just seeing the faded line. I mean, it was still emotionally a lot to see the faded line, to realize I was going through another miscarriage, especially if at the same time, like I said, I'm one of 10 kids. I got a lot of siblings. They're all having babies too, and you're going to baby shower or somebody's just had their baby or whatever. You're still having to go through life and experience those things as you're seeing those negative or those faint line pregnancy tests. That I just sort of had developed that expectation and that, like, this is what's going to be. And so that was actually the really beautiful thing about when my daughter came along. I remember, like, okay, I'm going to go take my pregnancy test. Like, let's just see what it is. And I went to pick it up after, and I had definitely gotten like a routine down. Like, okay, take the test, put it down, do not look at all until like I don't remember. I like shortly after the 2-minute window, and then I would check it again at like 5 and 10 minutes. And then sometimes 20 minutes later, like I said, I'd be like looking to see if it was the faint line or if it was just the dry line on the test. And so I had picked it up fully expecting, like, I didn't even tell my husband I was taking the pregnancy test. I was fully expecting to just see another faded line or no line and just be like, okay, here's another one. And it was just like I said, there's like super bright blue line. And I remember looking at it and being so confused and being like, okay, I must have done this test wrong. Like, this is like, something's off here. And like pulling out the instructions as if I need to read the instructions on a pregnancy test at this point, and like rereading it and then looking at the line and then rereading it and looking at the line. And I was like, oh my gosh, I'm pregnant. And this looks like it's really good. Like, this is a nice, bright line. And I just burst into tears. And I remember walking, I think my husband was sitting in bed, and I'm like shaking, holding this thing and like crying. And he's like, what is going on here? And that was my daughter. So, the going through the time in between, it's hard to describe. It's sort of a dullness because you've just built up the wall, you've built up the expectation to try to mitigate your emotional response so that you can just get through it. It's not that your emotions aren't there, but just how you're handling them is a little different because you know they're coming. So then I was just, pleasantly surprised by different emotions when my daughter finally came up.
That's so beautiful. Of course, there are mechanisms, right, to cope, and
Yeah,
you want to be realistic, but also have that expectation of, there are good things coming my way. It doesn't have to be that it's,
yeah,
bad, but at the same time you're trying to protect your heart. So there's so many emotions that are
yeah,
happening in that moment. And like you said, even just seeing that line, you're celebrating the life. And obviously when you see a nice big bright line, you're like, okay, wow, this is good. But of course there are so many emotions that we as women and couples go through when it can be a roller coaster, right? When
yeah,
you don't see a line for months and months on end, and then you see a line, and then like in our case, and then to lose the baby in an early
yeah,
miscarriage, and to say, oh, like go through the joy of getting pregnant again, and then the disappointment and the grief of that. So
yeah,
I think that there needs to be a lot more in terms of emotional support out there for women, for couples who are
yeah,
experiencing this. So you've spoken so beautifully about seeing your miscarried children and even very early embryos as real human beings, worthy of love and mourning. What shaped your understanding of the dignity of human life that way?
Well, I mean, part of it's just a lifelong dedication to the right to life movement. I grew up in that environment. I was involved pretty young with right to life issues. So I knew pretty well, like all the stages of development and like what the embryo looked like. And I feel like you can't see that, which science has so wonderfully exposed to us. You can't see all those stages of development and say there's no life here. I just to me, you see the cells moving, you see the body working on its own. It's incredible, it's beautiful, and I think that was just the backdrop I always had to that perspective anyways. I mean, it took on a new layer, of course, once I started going through the miscarriages, but, the woman from A Mom's Peace who is just a fantastic person, she works in the Arlington or the Virginia area with the Arlington diocese, but just in the whole DMV area also with moms who have miscarried or stillborn children or anything like that. And I remember going to do the funeral for my first miscarriage, and I was there with the little casket box that I had bought and made myself. And she looked at me and she said, "You know, this is mother." And it makes me emotional to say that. But, I felt like a mom. It was right before Mother's Day, the month before Mother's Day that I lost my first child. But I really still had the sense like I'm a mom. There was a baby there. That was my baby. And I'm a mom. But to have somebody else say your grief, your expression, the things you're doing, these are all part of your opportunity to mother because you don't have another way to do it. And I think that really reinforce that relationship, the mother to child relationship. And through that, really reinforce the acknowledgement of the humanity of the unborn child. And I think that was a big part of just going forward, how I understood even life at an embryonic stage to be something important because they are real and they are alive and they are human is why I get to say I'm a mom and this is mothering.
Hmm.
So, not the way I'd like to mother, but it is a part of life. So,
And so beautifully said. And we've also had such an amazing experience with A Mom's Piece as well.
oh,
And
good. I'm glad you guys worked with them too.
yes, yes, and also doing the burial services for our two miscarried children. But it's such an important ministry because
Yeah.
it really is so dignifying of what those children deserve, right? They deserve a proper burial. We had a deacon there. It was just really beautifully done. And, one of the things that struck me when we had our services is that, obviously from a Catholic perspective, the goal of what parents ought to do, right, is bring their children to heaven. And
Right.
obviously we want those children with us, right? We
Right.
want them to thrive and grow and eventually become saints and have a good life here on earth. But in situations like this where that's not what's happening is that acceptance of, okay, well, obviously this isn't what we wanted, but accepting that reality. And from a Catholic perspective, I mean, I guess it could be taken in different ways, but some would consider that these children are in heaven. We can have a whole theological debate about whether or not they are.
I'm going to say they are, but
But yes, you're
that's
right,
my quick take.
exactly. Exactly, and but it's beautiful
And
to
that's the
say
thing,
that.
sorry to cut you off, that I think is an important part about the education around this issue, and especially for priests in parishes to understand what they can do to help families and how they can educate. You can baptize your child's remains at home if you had a miscarriage, do it. Absolutely, you can do that. It's an emergency situation. I think the Lord in His mercy will take that into account. And I think for priests to say that to people, to let them know that's there, and also to let them know about burial options, funeral options. Even if you don't do a funeral service, you can still do a funeral mass, which we did for some of our children because, like I said, I had some of those early chemical losses that I didn't realize that's what they were at the time. And so everything other than that faint pregnancy test progressed like a normal period. So I didn't really know what to think. And until I talked to the maternal fetal specialist later, and he was like, "Oh yeah, no, those are chemical abortions. So you definitely had miscarriages." So after the fact, we still wanted to do something, and we had a funeral mass actually in our home for our children. So having education, not just for moms to know and their spouses to know what kind of opportunities there are and what you can do to practice your faith in that context, but just to have your church community also know so that they can be there and your priest to support you is huge.
Absolutely. And one of the most touching things that the deacon said when we were at the funeral, the burial service, was while you were carrying your child and you were going to receive communion, that child through you received communion. And it was just such a beautiful reminder that even for a bit of time, that child and those children were with us. And another little known fact is that every single pregnancy, there are cells from that
Yeah.
child that remain in the mom's body forever. And so there's a part whether that child was miscarried, and
Yeah.
unfortunately when women have abortions, etc., they still carry a little bit of their child with them forever
Mm-hmm.
physically. And I think
Mm-hmm.
that's really beautiful to remind people or even express, just because that's not something that's very well known,
Yeah.
but it's important. And I think that especially the church community doing more to support families and couples in all of these, whether it's an infertility journey or a
Right.
miscarriage, etc., is part of what every parish should have,
Yeah.
because it's something, as we said, it's common and one in four. And so it should be, if a church doesn't have that ministry, they should consider it, or at least to promote organizations that can help couples and families who
Yeah.
are facing that.
And it's a big part of being able to process the grief too. For me personally, it was a big help. And then I know women of like my mom's generation. I remember her telling me after I started experiencing this about a friend of hers who had had a miscarriage, who we both knew from our church community. And she didn't have any sort of chance to do a burial or anything. There wasn't any discussion around it. And she's told my mom that to this day, it haunts me that we didn't do something. Preventing women from carrying that extra grief around not being able to properly honor their child's life and process everything they went through is a big part of it too.
And just another note, there are cemeteries that have a section for
Hmm.
miscarried children, and even some funeral homes won't charge families who are experiencing, whether it's a miscarriage or a stillbirth, etc. So that's available, but also for women and couples who have gone through a miscarriage, there's still, and obviously didn't go ahead and do all of that. There's still ways you can honor your child. You can
Right.
there's remembrance gardens, there's
Yeah.
other ways, even in your own home, you have an ultrasound or something like that, or even just maybe the pregnancy test, etc. There are ways to just honor and remember. And so obviously if you didn't go through a burial service or anything like that, there's so many ways that people do honor. What are some of the ways that you have honored and are honoring your miscarried children?
Well, like I said, we did do a funeral for two of them. And then for the last four, which were all much earlier, and some of them I didn't have any confirmation about, that's really what happened until after the fact. We did a joint like funeral service mass. But then some extra things that I did on my own was like you just suggested. I had an ultrasound for two of them where you could see the baby there, just so nice and tiny and cute. So I kept my ultrasound pictures and I made little memory boxes, shadow boxes that go on the wall. And for the ones that we had a funeral, or in some cases, somebody sent me flowers, even if it wasn't like the funeral flowers. And I let the flowers dry out and put them in the shadow boxes. And so for the babies, I didn't have ultrasound. I did that. And I did save a pregnancy test. But I also did other things like I gave each of my children names. They each have a name, their birthdays recorded. We have a family Bible that their names and their birthdays are recorded in. And then their names and everything are on the shadow boxes as well. And in Hispanic culture, which I'm Cuban on my mom's side, there's a tradition of putting gold on your babies. A lot of people like to put gold on their babies, but in particular, you do a little gold, typically gold, sometimes silver, baby bracelet. And it's usually part of their baptismal gift that they get. So my mom actually was the one who, for my first miscarriage at the funeral, she gifted me a baby bracelet, which of course I just like burst into tears when she handed it to me. Like I hadn't even remembered that tradition. And so her giving me one of those bracelets was just so meaningful. And so I had put that in the shadow box for my first baby. And so with the additional miscarriages that came on, I decided to keep that tradition going. And so they each have a little piece of jewelry. Some of them it's another little baby bracelet, and some of them I actually found at an antique store some very pretty little baby rings, which apparently used to be a thing. So that's their little piece of gold and something to remember them. And then we try to every year go to. Oh, sorry, I actually had a funeral for 3 of my children. Like I told you, part of it was a blur. There was a lot happening. So 3 of my children are buried at the cemetery, and we usually go once a year during the month of November, which for the Catholic Church is the month to remember the dead, to just pay a visit because I want their siblings to know, their siblings here on earth to know that they have siblings up in heaven and to appreciate their lives also. So that's kind of the variety of things we've done.
It's beautiful. Yes, we named our children too, and in fact, when we say our prayers with our son, he knows their names, and we
No,
pray to them.
lovely.
So even as a
Yeah.
25-month-old, he knows their names.
Yeah.
And so it's just a beautiful way to honor them. And even if you don't know if you had a boy or girl, you can give them a boy first name and a girl first name, or vice
That's what we
versa.
did.
And that's what we did too, just because we don't want to say, well, this is what we don't know. We don't know what who that child was. And in the Catholic faith, we know that at one point we will meet our miscarried children and know them. And God will reveal to us who they were and what their purpose was, even for that short amount of time. Let's talk about the silence that surrounds both infertility and miscarriage. We already talked about how churches really should have good support systems for
Yeah.
this, and some do and some don't. But why do you think so many couples suffer in silence, and especially in the church community?
Some of it's generational. I think even down to my mom's generation, it just wasn't something you talked about. And, part of it is just the advancement of medicine, too. Like the chance of losing a child for centuries, millennia, up until now was so much higher during pregnancy. I think there was a lot more of just keeping all of that quiet, everything about pregnancy quiet up until really recently. So I remember just speaking to my grandmother about it, and she said, you just didn't talk about it. Nobody talked about it. It was sort of a weird thing to talk about anything to do with, the particulars of pregnancy. And I think some of it might be American culture and a bit of difficulty addressing death and uncomfortable things in life, and sort of wanting to put all that behind a fence or somewhere else. And so it just, I think there's that generational piece of not talking about it. And then there's that cultural piece of not knowing, which I kind of just said already, how to address hard things and death when it's in the context of something that should be so celebratory and full of life and exciting and wonderful. And I think it's just really hard for people to exist in that space, to acknowledge that space. Maybe it's partly my personality, maybe it's partly my culture. Latinos tend to be a little more upfront about death. And in some of our humor, we can be a little more direct about it also. So there just wasn't, for me personally, an issue with expressing these things or talking about it with other people. But I know for sure I can see the discomfort in other people. They don't know what to say. They don't know how to respond to it. And then you add on top of it this culture with, the IVF and abortion and everything else where people are hesitant to acknowledge, life at a certain stage. I think there's a lot of factors there. And then on top of it, because you have the silence, it doesn't make room for that education to happen. And so you have a lack of education, especially, I mean, priests are men, that's part of God's design, but it means they're not experiencing this and they don't have a spouse through which they can experience it. So it might just be a bit of a blind spot for them as well, unless somebody's really introducing to them that, hey, this is what women in your community are going through. There's a couple things I think that play into it, cultural, and then just the certain things about the way, the priesthood is structured to like be aware of this type of thing. Those things I think altogether contribute to it.
And I think that that's an opportunity, right? This is something that should be taught in seminaries. Why? Because
Yeah. It
seminarians
should
and
be part
priests.
of marriage preps. That's my like, my little
Yes.
goal is to try to initiate some sort of part of pre-K now. We already introduced the natural family planning stuff. We should have a conversation about miscarriage.
Right. And both on the side of couples preparing for marriage, that they should know that this is a real possibility,
Yeah.
and also on the part of the priests,
Yeah.
that you are in your community, there are families who are either currently going through a miscarriage or have gone through a miscarriage, and it's
Right.
important for them to know how to be of support and how that parish community could be of support to them. Were there moments where you felt invisible, misunderstood, or you simply didn't fit into the culture around you, whether in the medical sphere, when you went to appointments, or we already talked about the spiritual sphere, but even just culturally or around friends or etc. in at work.
Definitely, and that's the funny thing about especially being a Catholic in this kind of situation is you sort of get it from both sides. When you're out in the culture with people who are not religious, you're dealing with it on that end of people who don't have a sense of honoring life at that stage or acknowledging life at that stage. And that means that they also have trouble acknowledging the grief that comes with losing life at that stage. And so some of it is things like, you just get comments when people see you have two kids that are 4 years apart. On the very secular side, people go, "Oh, you did such a good job spacing your births. What an ideal space between your births. Isn't that wonderful?" And I was like, wasn't intentional. I can appreciate there's a little silver lining there that my older son is very can take care of himself and doesn't need as much as I have this younger baby. There I can understand that. And I try to be patient with that. And then there's just like when you're going to the doctor and it's not a pro-life or religious doctor, or someone who just empathizes deeply with it, and that was my experience with my first miscarriage. And that's honestly why I was like, I need to find a doctor that I'm very aligned with on these things. Because I remember, so part of what happened with my first miscarriage, like I said, I went in and I met with this nurse who was very kind and tried to help and got the scan done and tried to encourage me. And she said, come back in 10 days and we'll do another scan to see. And during those 10 days is when I had the miscarriage, but I wasn't entirely sure that's what happened. That's how uninformed I was. Despite the fact that I went through labor pain and passed a lot of blood and tissue, I was still thinking maybe I didn't have a miscarriage, which now I look at it and I'm like, I can't believe I had that thought. The nurse was trying to be encouraging. And I came back to my 10 days later appointment. And of course, we went in for the ultrasound and there just was nothing on the ultrasound. My uterus was completely empty. And I remember looking at the screen because they have the double screen so you can see the screen also and seeing that she was seeing nothing. And I just started crying. And the tech who was doing the ultrasound was like, oh no, she's getting upset. And she was like, and I said, do you mind if I call my mom? She said, sure. And she said, I'm gonna go get the doctor. So she went to get the doctor. And the doctor came in a few minutes later, and I remember him there with the nurse, and they just had this look on their face of like, I don't know what to do. Like, oh my gosh, she's so upset over this miscarriage she's had at like 8 weeks. And she was like crying. She's on the phone with her mom. And you could just tell they did not know how to address it. And probably because a lot of OBs have that, I don't see you to 8 weeks, you deal with that on your own at home. They don't see women dealing with these situations at that stage. So they don't have an appreciation for what it's like. So I really got that read from the doctor. And I remember him saying, I looked at your ultrasound and it just looks like a normal empty uterus. And I remember just being like, man, you really chose the word,
Hmm.
the worst words ever. Like, no woman who was pregnant wants to hear you have a normal empty uterus. I mean, I just had to have a certain level of like patience because I could just tell from their faces they had no idea what to do. And the nurse, I saw her again afterwards, and she tried to encourage me and tell me, if you need grief counseling, what have you. But you could tell they just were so confused. And it was night and day difference when I went to my OB-GYN, who's a pro-life, NAPRO certified practice. And, they were sending me cards after I had miscarriages. They were saying, I'm so sorry. Like, it was all a culture of understanding the loss that you're experiencing and trying to be there for you. So on the flip side, though, of like you kind of asked about being Catholic and in your church community, you do have those awkward moments. People see the birth space and where the difference in the spacing with your children, and where the secular person might congratulate you for good job, you spaced your birth so well. The more conservative religious person is going to be like, why are you having kids so far apart? And why do you only have two? And it doesn't help that I'm an attorney and I work a full-time job. And so people I don't know that I've really had okay, no, I have had somebody say something. I've had some family members say to me, you really should have children closer together. You really like, it's better to not wait. And this person knew I had been through multiple miscarriages. And I'm just like, seriously? You don't think I'm trying? I'm trying. It's just not working. And so some people say it out loud, and some people just look at you and your children, and they're there with their gaggle of six children, and they're the same age as you, and they've been married the same amount of time. And they're just like, are you sure you're not just prioritizing your career over your family? It's sort of that awkwardness. So, I mean, I've had that. At this point, I've learned I think so much about going through grief and situations like that. You learn to exist in awkward spaces where people just don't know how to deal with you and respond to you. And there's a certain amount of just ownership of yourself and your situation that you can develop, which it feels good to have that sort of security about myself. And like, I know my faith. I know I'm faithful in my faith, and I know my situation, and how people react to me is not going to hurt me because I'm secure in that. And so I've been able to develop that. And so that gives me a level of patience for encountering when people say these sorts of things, to just be like, no, actually I lost seven children. And people are like, oh. Some people get overwhelmed by that. But sometimes that's what you need to tell someone to make them realize that not everyone's on the same journey as you.
Mhm.
Yeah.
No, so beautifully said. And I think that there's a part about normalizing this reality of life, right? It's an
Yeah.
uncomfortable reality, one in four, but I think it's important for people to know. And I had a similar situation where, I posted pictures of our family, and someone said, well, when is the sibling coming? And internally, I thought, well, he has two siblings that passed, and we had no control over that. I was on the
Yeah.
progesterone. I was doing it was something outside of our control, but it's hard to share that with somebody who is, a distant acquaintance on social media.
Yeah.
And so finding the
And
right place.
you know what? Sorry to interrupt you again. I know I keep interrupting you, but it just reminds me of, to answer your question about why people don't talk about it, something I forgot that was a huge part about it that has frustrated me. I think this is the one thing that gets me the most upset. There was a very strong belief that if a woman miscarried, it was her fault. For a long time, you lifted something too heavy, you exercised too hard, you ate the wrong thing, you didn't eat enough of the right thing. You did something wrong. And I think that culture of shame around miscarriage, like, why aren't you bearing children? What sin did you do to cause your barrenness? It's ancient. We see it in the Bible. So I think that's a part of why people don't talk about it. And I have seen that. I've had people say to me, older relatives, like, make sure you're careful this time, as if the last time I wasn't careful and I somehow contributed to what happened. So that, like you're saying, it was out of my control. I did all the things I could, and it was out of my control. And women have to realize that they shouldn't beat themselves up about it. And medicine tells us that a lot of these things are out of our control. You do what you can, and then you just got to keep rolling.
Right, absolutely, and I think that that's a really good point, especially when it comes to something like, sorry, a chromosomal abnormality or something like that,
Yeah.
where It's literally your body is doing that because something's not right. Obviously, part of what is under our control is to figure out, like you did, what is it that may be contributing. And so, for
Uh-huh.
example, if it is that you have low progesterone, taking progesterone will actually help you sustain pregnancy. Not that it's a guarantee, but it is something that you can do. For the most part, it happens before you even know, and you don't
Yeah.
know why it's happening, and so it is
Yeah.
out of our control. So I think that it's understanding what about our bodies we can do and what we can, and really this is it's kind of like a fertility journey that you go on, and there aren't answers right
Yeah.
away. And again, it could be a male factor, it could be the female factor, it could be a combination. And so just having that kind of compassion for someone going through this, that it's not something that they did or caused, but there's something going on that they're trying to get to the bottom of. So on that topic, right? You mentioned what this older relative said. Some people will say, just relax, or it'll happen when you least expect it. What are some other painful or insensitive things people have said, and what actually helped? What are the good things that people have said that have helped?
Well, I'll give an example. I've given some examples of unhelpful already, but I'll give another one. A lot of people will say, "Don't worry, there'll be another one." That one always gets me because I know they're trying to be encouraging, like, "You'll get pregnant again," whatever. But saying that is somewhat dismissive of who the child is in that moment, that unrepeatable human being that you will never meet again until another life, until we pass from this life. And so that one is I have to have patience for it. 'Cause I understand that it's coming from a good place, but it's not acknowledging the person who's here and now that we've lost. So, I mean, that's one where people try to be helpful, but it can sort of obviously the ones where it's somehow your fault or you should really be trying harder are like an eye roll or like infuriating. I'd say some of the best things that I've been told. I'm not an elephant in the room person. I'm an upfront person, like I said. And so for me, it's always a little bit awkward or weird when people don't want to say anything because they're worried about saying anything. So I'm always just like, so I will often initiate the conversation because I want them to feel comfortable acknowledging, like, we can talk about this. You're not going to like crush me and I'm going to, go home and sob for another week and you won't see me at work again if you just acknowledge that something happened. So I always try to encourage people in that way that you can talk to me about it. But some of the most beautiful things, and I'll say two that really stick out to me. With my first miscarriage, a friend of mine from college, we had been roommates in college. We're very good friends, and her very first pregnancy was a miscarriage also. But of course, she went on to have 7 beautiful children after that, and thankfully no more issues. But of course, she went through that. She knew what it was. And I remember her sending me a text message, and she said, "I'm so sorry to hear about what happened, but I want you to know," sorry, it gets me every time, "that your baby is loved by me." She just, in those few words, completely acknowledged what I was going through, who my baby was, who they were to me, and that she recognized all of that. And just by saying, "Your baby is loved by me," acknowledged their humanity and how important they were. That I think about that one all the time. And then the other was actually, like I said, I had this supervisor who was just really wonderful, and a gift to have as supervisor for years as I was going through this. And I remember he came to my office after I'd taken a week off for, going through the miscarriage and everything. And he walked in my office and he didn't even sit on a chair. He just like sort of plopped against the wall of my cubicle and sat down and just looked at me. And I knew immediately why he was there and what he was trying to convey. And he didn't even have to say anything else. But just the fact that he stopped and acknowledged what had happened just meant everything. While, everyone else in the office is trying to sort of pretend nothing's going on because they don't want to disturb the peace or anything awkward come up. So I think those are some examples.
Absolutely beautiful. And I think this also speaks to the broader question of the fact that when people are going through suffering, it's important to, at least to some extent, acknowledge that, right? Because
Uh-huh.
it's internal, and I think people avoid it because of the reasons you said. They don't want that person to, start crying or make it awkward or uncomfortable, but just by being with someone and telling them it's
Yeah.
okay to have those feelings. It's okay. If you want to process with me, I'm here.
Yeah.
It's important, whatever the suffering may be, whatever
Yeah.
a loss there may be, or who knows, maybe a disease, condition, a loss of a family member. In any of those situations, or even just a hard time, it's nice to when people actually acknowledge and give you the space
Yeah.
to share and not pretend like everything has to be okay and put a
Right.
band-aid on it and pretend like we don't have to talk about this and we'll move on, because I
Right.
think that there is a part where it helps you to heal
Yeah.
when you're able to just tap into that and acknowledge it, and it actually helps people move on,
Yeah.
not necessarily move on that it never happened, but just to heal from it and be able to move on in a healthy way.
Right.
Yeah,
Exactly.
right. Let's talk about how this affected your relationship with God, right? As you already talked about how in Catholic culture, you may be judged if you don't have a big family and people don't quite know why not, or they might think you're just going after your career, etc. But did you during this time when you were going through the miscarriages, were you angry at God? Did you just feel bewilderment? What was going on spiritually?
I think probably bewildered is the better word. I mean, I definitely had this sort of why feeling. And it's interesting because going back to your initial questions about what I expected my family life to be growing up and when I was a kid, I remember learning about miscarriage as a teenager. And at some point sitting in my bed and just thinking about it, and I don't know if I'd seen a movie where it happened or if someone at church had happened, whatever, and thinking like, I don't think I could ever deal with that. Like, please God, I don't want to have to go through that. Like 16-year-old me was saying that prayer, and God was like, no, this is your path. So there was this element of like, I asked you not to have this happen to me, and yet this is what we're going through. And it's happening again and again. And I don't have an answer as to why. And I think that was a really hard part about it was not knowing the why. Like, okay, if I have, PCOS or if I have something, at least you kind of understand there's something there that we can work on, we can focus our attention on, what have you. But I was just sitting in this void of, I have no answer as to why. And I really just have to accept things for what they are because I've got nothing else. And I remember talking to a good friend of mine who he and his wife have 9 children, but they did have 3 miscarriages. And he said something about it. God just wanted to take those children home early. And you have to think about what a blessing it is that they just got to skip all of this hard part of life and go straight to heaven, and don't have to deal with all the stuff we have to deal with. And I said, that's a really nice thought. And I appreciate you saying that. But I just can't help but feeling like maybe they needed to go because if they stayed here with me as their mom, they were going to be off onto like some terrible path. And this is like, God saving them from me kind of thing. And we laughed about it because I was, but there was a truth to it. There was just like there was a piece of me that was like, am I just not really cut out to be the mom of 10 kids that I always thought I was cut out to be?
Mhm.
But like I said, you have to just process all of that. It is so hard to process all of that because your life isn't looking like what you thought it was going to be. Dwelling on whether or not it's because there's a deficiency in you isn't going to help anything. And it also, in my case, I already had my son, is not going to help me be a better mother to him, or to be a better um, person in my community, in my job, in my marriage. It's hard to process all of that, but there's so much that's beyond our knowledge. I think I fortunately have been given a very strong upbringing in having a lot of hope for the future and a lot of trust in the future. I like to say I'm very much a realist, but I also like a big dose of hope. And so I think that helped sustain me, and that I did have to, in terms of like spiritual relationship. with God, turn more to Him, both for in my frustration and in trying to process, but also for comfort because that's part of our faith also is you go to God for those things. And to just it was a space in which I could have and frustration and bewilderment, but also have hope.
Beautifully said. And I know we felt similar feelings, right? Like, God is
Yeah.
God of pro-life. God is the God of life. So why is there so much death
Yeah.
when life should be happening, right? And it's hard to understand. And I think it's understanding that we don't. Some questions may never be answered until we meet God.
Yeah.
To really understand, but also to sit with that unknown, right? And to
Yeah.
just praise God for the life that was, and that you will one day, God willing, meet again. And even in that, not understand why. What I came to understand was that this is the product of the fall, right? Like
Uh,
our bodies and that why is there disease? This is the problem of suffering, right? The problem of evil in the world, that God is the God of life, that any death and suffering is actually a result of the fall. And just to understand that, God is with us through that journey of whatever suffering we're going through. So for you, what role did prayer and the sacraments and the faith community and family and friends play during those hard moments and in your healing?
I mean, they were the support system. I could call my mom and talk about it. She couldn't personally empathize with me or identify because she didn't have that experience, but she could still be there as my mother. My siblings, and I remember several of my aunts and uncles giving me calls, my grandfather, which it's really beautiful to see things like that because some family members are more emotive, expression-filled people, and some people are really a lot more reserved, and you don't get to see that emotional side of them very much. So when they reach out to you in those kinds of circumstances to express something, it really means a lot. And I think it's just the whole framework of my faith that it's full of our faith, that it's full of people like you, Arena, who have an appreciation for what it is and for life that's what supports you. Because I remember this feeling after my first miscarriage and especially after some of my other ones. There was so much grief, but I felt almost like I wasn't allowed to have that level of grief because I knew moms who had lost their baby like within a week of their due date, or the baby was born stillborn, or died shortly after birth, or they had a miscarriage midway through pregnancy, some major complication happened, and they lost the baby. And it's like those circumstances are just so horrible that you feel like, can I even is it valid for me to say, well, I'm going through this pain and sorrow and grief over losing a child when I knew my child existed for a week before they were gone, or I never actually saw them or saw an ultrasound or had any sort of really relationship with them. The loss is different. It's going to be more overwhelming because, after 9 months of pregnancy to have that kind of a loss. And I remember feeling that sort of awkwardness, like, does it really make sense to have this much grief over this? But to be in a community and a culture and a family and a faith that understands life and what it is helps you not feel crazy. And I think what it's really beautiful about it is your body, and I said this you're talking about some of my Facebook posts that I've talked about my miscarriages, and I said this at one point, your body seems to know the grief and the loss more than your mind does. You just feel this weight, you feel this loss, you feel this emptiness. That's really, really hard to describe because the logical part of your brain is like, why are you so upset about this? You didn't even know this person. They weren't even like, baby with squishy cheeks and chubby arms that you could be sad about losing. But there's something about that physical reality that your body knows that then to have a faith community and a family community that can validate that it erases that dissonance and just, I think is more acknowledging of reality and helping you process everything.
Yes, absolutely. Yeah, beautifully said that your body knows even before your mind, and the reality of what's happening and the loss of it, right? It's a
Yeah.
loss to us, and it's okay to grieve that. And yes, the grief may be stronger, of course, when you have a child who's older or stillborn or born and then passes away after a couple hours. But also just acknowledging that you have a right to grieve your child who was only 5 weeks or 6 weeks or 7 weeks or 4 weeks or however
Yeah.
many weeks that that child was, right? And will always be, and like you mentioned, that there is never going to be another person who was like that child, and that that
Yeah.
child means something, not only to you, but to God. And so and it's okay to grieve, and I think just giving ourselves the space to allow that to happen, even helping educate others that it's okay to have that space, right? Because I think that as we talked about in culture, it's you don't wanna show your grief or even share that that's happening, but I think the more that we normalize processing grief, it helps others to do so as
Uh-huh.
well.
Uh-huh.
So let's now just turn to experiencing that big, bright, positive test with your daughter and even with your son after the first
Uh-huh.
miscarriage. So, knowing that, well, not knowing for sure because you never know, but seeing that line and thinking, well, this is a very good sign that this line is strong. How does being pregnant and especially carrying to full term, how does that experience how was that changed after the miscarriages and how does that change your experience of pregnancy itself?
Well, you definitely are more on edge the first 12 weeks in particular. I mean, the fact that there was a consistency and a pattern to my miscarriages made me feel like if I got past 9 or 10 weeks, then I could breathe a sigh of relief. Especially because as I had more miscarriages, the doctors were more willing to get me in sooner, do more testing, more thorough testing, more frequent testing so I could track, the HCG hormone rising, my progesterone rising to make sure everything was on track. So that was an extra level of comfort that I was able to get with my second full term pregnancy with my daughter. Because of everything I'd been through, they were like, yeah, we're going to give you the work. I wish we could just all have the works for every pregnancy. But I think I had less fear with my son because I really blocked off in my mind that first miscarriage as just the thing that happens to a lot of women first pregnancy. And so I just didn't let that translate into possibly something that was going to happen again. It was like, okay, that's a one time fluke. Whatever. With my daughter, I think I had to have more I was more on edge until I really got through those first 10 weeks, and there was a moment where I did experience some light bleeding, and I remember just being like, "This can't be happening. This does no." Like, I had the bright blue test, the ultrasound was fine, like, this no, and I remember we ran into the doctor's office, we did tests, everything was looking fine, and they were like, "Well, we'll just keep monitoring," and thankfully, the blood cleared up within, like, 2 days, and everything then progressed as normally, so it was probably like a, leftover implantation bleeding or something like that, it's hard to say. But I mean, I know for some women, it can be really, really hard going through another pregnancy, and they really don't wanna share any information about it or until they really are, like, midway through the pregnancy, like, even way past 12 weeks. So I'd say it affected me, but I had, a little bit of a different experience where once I got past 10 weeks, I felt like, "Okay, we're good to go." And then I could just sort of enjoy the highs and lows of pregnancy in the way that every other woman does.
Did you ever feel like fear stole your ability to fully enjoy the pregnancy? And if so, what advice would you give to a mom, to a couple who are going through something similar?
I think I had a mindset of because I had developed this mindset of this is my new reality. That helped me with my daughter. I mean, the fear is there. It comes to you. You can't stop it. It just comes. As every time something feels a little bit off, or like you said, you get a little spotting, or, even later in pregnancy when you feel like maybe your baby isn't moving as much as you think they should be, or whatever. And I just had to keep reminding myself that, if this is going to happen, if this is going to go through, it's going to go through. And if it's not, it's not. And I just have to accept whatever comes. Just have an openness to what is going to come. I think the more that we're guarded about it, just no, I can't lose another baby. I can't. As much as I even had that instinct, like I just described with when I started experiencing the bleeding, we do have to push back that against that because you just won't be able to cope as well if it does come. And I think having an openness to whatever could possibly come, it's a way of letting yourself submit to God's will and being open to his guidance and his leadership in your life. But it's also important for just your own ability to process whatever does come. It's not that you wanna have no sensitivity to if something bad happens, you're obviously going to, but just being open to the fact that that's a reality. And for myself in particular, I think it's helpful to think about the gifts and the blessings I do have. I have my son, I have my children in heaven, I have a home, I have a wonderful husband, I have a beautiful big family, and I have a great job, I have wonderful friends. There's so much goodness in my life, and there's so many people who have just so and every parent says this, like, eat your food because there's children out there who are starving. But letting that reality sink in, um, whether it's through just actually going and doing service with other people whose lives are much less fortunate than you. One thing I've done just with the miscarriage is being open about it so that other women can come to me about their experience, and then I have the opportunity to sit with them in their grief, give them the information I can, explain what I've gone through. And that keeping hold of that reality of life helps you be braced for, whatever reality comes your way.
And you have your daughter too, which is like, the silver lining after so many
Yeah,
miscarriages.
absolutely.
And obviously, and this brings me to this other question. You're hoping to continue growing your family. Given everything you've experienced, how do you approach trying again now?
It does feel a little bit like we're back at square one because we don't have a clear answer of what happened. I haven't experienced any further miscarriages since, which I'm thankful for, but I know sort of looming in the back of my mind is I have this very high chance that it could happen again. So we've sort of embarked on let's just do all the testing, the things that I didn't get done before my daughter came along to find out. So, for example, there's exploratory surgeries you can do for endometriosis, and that's my next step is to try surgery. I did everything not surgery, so now I'm going to try for surgery. And I think it's just part of trying to be educated, like you said, what's what's going on with your body. That path is going to be different for every person because it can be tiresome. And it is a bit tiresome to be back at the medical testing stage, trying to figure out what's going on. But I'm armed with a lot more knowledge. I know I have, certain medication routines I can do to help support us trying again. And so I'm just trying to maintain that view that I just described of being open to the possibility that we don't have more children, or maybe we do and they just don't get to stay with us as long as we would like. Or maybe I get lucky and I get another couple this side of.
Beautiful. What role did your husband play through all of this? And how did repeated loss affect your marriage?
Well, um, I do think it's interesting to talk about the experience for husbands because there's a variety, like with all people, there's a huge variety in how people respond to a loss like this. And what's difficult about this particular type of loss is it can be so personal to the woman because your body is the body that's experiencing it. You're feeling the hormones crashing. You're seeing all the blood loss. You're feeling the loss of your child. You're going through the labor pain. You're physically experiencing it in a way your spouse isn't necessarily going to or isn't going to be able to experience it. So I think that, my husband has experienced loss in his life. He lost his mother as a teenager. And so in that sense, he's not a stranger to grief. But it is interesting to see how these things affect your marriage because he's a lot more of a black and white person. It's a little bit like you're sad or you're not. There's a problem or there's not, and I'm a little bit more emotive and there's a lot of nuance there on the scale. And like you're talking about this experiencing grief and joy at the same time. Like for me, it's not a strange place to exist to have a lot of joy and a lot of grief at the same time. Whereas for my husband, that it's like, you have these things, so we should just be joyful. And just understanding, holding, or carrying the grief is a little bit strange to him. And that's part of marriage, is realizing people have different personalities, they have different ways of processing things. But I have seen the way it's affected him. I mean, just he sees the weight of what I'm going through, and that puts a weight on him. And he wants to be there to support me, to make me feel better, to help me get through it. And part of it is just a conversation of, it's okay that you can't fix this. And actually, we had that conversation recently. It's okay that you can't fix it. The fact that there's something broken in me that you can't fix and I can't fix, it's okay. And I'm okay. We're moving forward together as part of that being reality and supporting each other through that and acknowledging that reality. And, he's there for me with the kids and with even the babies that we've lost. And even just, I think for him, coming from a less religious household, coming from Europe, which in a lot of ways is a less religious society these days, I think it's a nice opportunity for him too to be able to speak about the children he's lost in a life affirming way to people who maybe wouldn't otherwise think about it that way.
Now let's turn to the meaning and hope and just looking forward, right? You shared a quote from Lee Sneed that infertility and miscarriage can illuminate the most beautiful things that come from deep brokenness. What have suffering and loss taught you about love, motherhood, and human dignity?
I mean, I think the biggest thing that I hold on to, and it really in large part comes from what Cara Mom's piece said about this is mothering, is that grief is an expression of love. It's the love that you wanted to show in the normal ways of love that you couldn't. And so it just comes out in the form of grief. And I think that's why I'm not afraid of it, because it's not this like big bad, you're broken and falling apart and can't keep it together thing. It's no, this is actually an intentional expression of love. This is a totally natural part of how I would have been a mother anyway. And I think that perspective on it gives a certain beauty to it and helps with processing everything that you're going through. And it shows you a lot also about loving the people you do have now, the ways in which you can express it. That love can take different forms, and it's just sort of it's a constant reminder of being thankful for what you do have, I think.
Mhm. Mhm.
But it does really change. It changes a lot of your level of appreciation and your empathy for people who go through terrible things also.
And just normalizing suffering, right? I think in our
Yeah.
culture, suffering and grief and death are taboo. Let's just do everything to pretend like everything's okay and death doesn't exist and we only live for this life,
Yep.
etc. And in this, you're saying it's okay to process grief. It's okay to process suffering, and there is death. And coming to terms with that, and that there is also life
No.
after death, both in a spiritual sense, but also in our life, that there is life even after loss. And as you said so beautifully earlier on, that your son's needs at the time continued as you're experiencing loss, right? And that there is still life to be had and life to be experienced with those around you, and as you're processing that grief. What would you say to the woman or couple listening right now who just experienced a miscarriage or is in the process of experiencing a miscarriage and feels completely alone?
Well, first, that you're not alone. You're not alone. I mean, like you said, so many women go through this. The loneliness comes from the intense personal nature of the experience, the physical experience, and it comes from not knowing that other people have been through the same thing. But understanding that other people have been through it, for me, helped me a lot pull through. And I mean, like everything we've been saying already, it's okay to grieve. It's okay to process it the way you're going to process it. It's not easy. It's something that I wish was not part of life, that it is part of life. And it's really hard to keep going and keep doing all the routine things after going through something like that. So I would just want people to know you're not alone. Look for the information you can to help you process and handle everything. And look to your community. Don't be afraid to talk to them about it because our community is what supports us, our community in faith, our community in our family, our community in our marriage. And it's okay and it's to need that because it's a very human thing to need that and to rely on.
Hmm. Beautifully said. And of course, if someone is going through grief and either doesn't have the community or needs even more processing, there's grief counseling and just knowing what you need, right? Knowing what you personally need to help you process it in a healthy way is the right way for you. So, what resources? I know you mentioned a mom's piece, and we both have so many wonderful things to say about that organization. But in addition to a mom's piece, what resources, organizations, doctors, or communities helped you most throughout this journey and that you would recommend to somebody else going through this?
Well, like we talked about already, a mom's piece has been fantastic. They are local to the DMV area, but I have heard that Kara will take phone calls from people outside the area, Kara Palladino. So that might be an option for you. Heaven's Gains Ministries is the group that I had mentioned before that do the miscarriage kits. They have a lot of info online. Their info tends to lean towards like uh explanation for the 12-week miscarriage, that kind of area. But they do have like a nice fold out paper chart that describes things when you get the miscarriage kit and you can get it rush ordered to your house. Or it's something that I think everyone should just have one in their home, anyways, just in case. Another group that I have not personally used myself, but that I've been recommended by a few people is called Redbird Ministries. I think they do more of the coping and counseling and everything after experiencing miscarriage. But then aside from that, it's just like I said, it's relying on your community. I've been fortunate also to find, like I said, pro-life and NAPRO certified doctor. Tepeyac OBGYN is where I currently go. That they are an explicitly pro-life practice founded by Dr. Bruchalski, who's, fantastic, incredible doctor with an incredible story of converting, becoming pro-life and everything. Um, and then any doctors who are really trained in that restorative reproductive medicine or NAPRO certified, they're gonna have a whole different way of looking at your situation and understanding your situation, wanting you to help find out what's wrong and see if they can fix it or see if we can support your body enough to get past whatever the issue is. It's just a lot more of a holistic medicine approach and it's a lot more empathetic to what you're going through. And for me, the difference between going to a secular hospital that didn't have any sense of that with my first miscarriage and then going to an OB-GYN that was their view, it was just night and day. And sometimes, it's even if the practice itself isn't listed as pro-life or what have you, the individual doctor, you might find that individual doctor. But I think it's important for people to be upfront when they go to the doctor about what matters to them, what their views are, what have you, so that you're not in this tense, drawn out relationship with somebody who you feel like doesn't understand or maybe even looks down on your view. You want to be in the hands of somebody in which you feel secure to help you through your medical journey. And sometimes that means changing doctor. But those are, I think, some of the groups and resources that have been most helpful to me.
Great. And we'll actually link to all of these resources and any other resources that you think would be helpful to our listeners here. Looking back now, what do you think your children, including the ones you lost, have taught you about life, love, and eternity?
Well, they certainly give you a lot more immediate impression of the eternity part. Without death and loss and those things, it's easy to sort of move through life thinking only about the temporal here and now and not the sort of bigger picture questions. And we're cushioned from so much of that in our society. And I think that's partly why I don't know if it's me being a bit transgressive or what, but I'd like to really push back against that comfort by being very open about what happened with the miscarriages and the losses that I've experienced and talking about those children and remembering those children and reminding people that they are a part of my life, they are a part of who I am, because you just can't help but think about, important questions around faith and life and our purpose here when you're confronted with death. And I think that's partly why people get very uncomfortable around it. But partly why I like to bring up the topic in some way because those are the important things in life. Everything else you're doing doesn't matter if you can't figure out that part of your life where you're going after it ends.
Right. And lastly, right off of that, what kind of hope do you hold on to today?
Well, I mean, I still hope that there'll be more that I get to hold and cuddle and kiss and irritate and all the things. So there's that sort of very obvious hope. And kind of going back to your prior question, there's knowing the reality of your children and having a faith that they're still there, just, you know, in a different place, but their reality is still there. It gives you sort of a more of a real-time feeling of interactiveness with heaven and life after death and all of that. It's just a little strange to think about because of, where we are, but it gives a new sense of reality to it. And that in and of itself gives you hope. A hope of seeing them again, a hope of that reality. Um, yeah, I think it's just holding on to what may come, but still being realistic about what might not come. And even if it's not a hope for the future, just thinking about the possibility of that hope and acknowledging that it might not come to fruition in the way that you want it to. Because the other thing about hope, we might hope for a very specific thing, like another child. But I think we should let our hope for something be more inclusive of other possible good things that come our way out of the grief and the loss and the things that we go through. I mean, there's Lee Snead has talked about this in becoming a mother after adopting her children, but also just in the ways you can be a mother without having your own biological or adopted children. And I know some women that way who they've known they're not going to be able to conceive for whatever reason. They never had their own children. And despite that grief and that loss and having to accept that, they've found other ways to live out that part of their life, to just give themselves to other people and to be a mother in different ways to people. And so I think hope shouldn't just be a fascination or fixation on the specific thing that we want, but an openness to all the positive things that can come out of the negative things that we've experienced.
Absolutely beautifully said. And I echo those sentiments. Obviously, we can hope for more children and at the same time, leave room for God to be God and for Him to show us what He wants of our life
Yeah.
and in the ways that He wants us to be fruitful not only physically, biologically, but also spiritual motherhood and spiritual fatherhood for our husbands, etc. And that there are so many ways that we can contribute to the world and to our families, even with what He has given us, and that He can bring good out of even these hard circumstances. And
Yeah.
it seems like He's already growing in you ministry for other
I'm still
families
plotting.
and women who've who've struggled with a miscarriage and
Yeah.
processing that. Thank you so much, Gabriela, for sharing your heart and just being so vulnerable in this conversation. And hopefully this helps other women, other couples as they're processing this or maybe learning it for the first time. We hope that there's priests listening to this who will decide to start a ministry for in their communities for families either going through
Yeah.
infertility or miscarriage, loss, etc. So
Just put
thanks
something on
again.
your website even. That's how I found A Mom's Peace. It was on the Arlington Diocese website. I went to the diocese website. I don't know why that was the first stop I thought of, but I did, and it was just right there. So, simple way, put a link on your website. Yeah.
Well, thanks again for being on, and we hope with you, and we pray for you as God continues to show you His path.
Well, thank you so much, Rena. It has been an absolute joy to be on this with you. Thank you so much for just giving me the opportunity to share.
For my conversation with Gabriela Anastasopoúlou, who has lived through 7 miscarriages while also raising 2 living children, here are 5 key takeaways about miscarriage, infertility, and hope after loss. 1. Miscarriage is far more common, physically intense, and emotionally isolating than most people realize. Studies estimate that roughly 1 in 4 pregnancies ends in miscarriage. Gabriela shares what miscarriage is actually like behind closed doors, including the physical pain, uncertainty, labor like contractions, and emotional shock that many women feel completely unprepared for because miscarriage is rarely discussed openly or practically. 2. Repeated miscarriage changes the way women experience pregnancy, grief, and hope. After 7 miscarriages, Gabriela describes how seeing a pregnancy test slowly shifted from excitement to fear and emotional self protection. She explains the emotional wall many women build after repeated loss and the overwhelming joy and disbelief she experienced when she finally saw a strong positive test with her daughter. 3. Restorative reproductive medicine seeks to heal the body rather than bypass it. Gabriela explains how NAPRO and restorative reproductive medicine helped identify a severe luteal phase defect after years of unexplained miscarriage, and why she and her husband chose not to pursue IVF. Their journey highlights the importance of investigating root causes of infertility and miscarriage rather than simply circumventing them. 4. Miscarried babies are worthy of love, dignity, mourning, and remembrance. Gabriela shares how she buried and honored her miscarried children through funeral masses, burial services, naming her babies, memory boxes, and family traditions. She reflects on how one woman told her, "This is mothering," helping her realize that grieving, honoring, and remembering her children was itself an act of motherhood. 5. Churches and medical professionals need to stop treating miscarriage as invisible grief. From silence within faith communities to insensitive medical responses, Gabriela explains why so many women suffer quietly through infertility and miscarriage. She calls for churches, priests, doctors, and communities to better support grieving families through education, practical help, acknowledgement of loss, and ministries that honor miscarried children and accompany parents in their grief. Because truth matters and human dignity isn't optional. This is Bioethics, babe. Thanks so much for listening to this episode of the Bioethics Babe podcast. If you've enjoyed this content, please subscribe to my YouTube channel and your favorite podcast platform, and share with your friends and family. Also check out bioethicsbabe.com for the latest episodes and resources.